this is Dr. Adam Kopsky coming at you from Advanced Rehab and Medical, and I want to talk to you about our topic that we're going to be having this week and also going into next week that actually talks about red flags of low back pain, and actually more importantly that this topic discusses is it dives into how thorough the exams are and why we have so much initial paperwork. And so we get a lot of patients come in and they're like, why do I have to fill out all this paperwork? And the reason in reality is because as healthcare providers and physicians, you want to know all the information, because if we don't have all the information and data, we don't know how to properly treat you. And so if you are one of my patients or have been under care with me, you'll notice the one thing is when we go to that new patient examination, I always say our job as physicians is not necessarily to treat everyone, but rather it's to diagnose them. And so we know chiropractic, medical, it's not one size fits all. We should all be working together to get you the best care. And sometimes, we do have a lot of options in our clinic to best help people, but in rare occasions, when we find those red flags and things like fractures, whether it's an aneurysm, which is just a ballooning of the blood vessels, and even small fractures, these conditions need to be referred out, and so that's one of the things we don't treat. And so if we don't get all that information, we don't know how to properly treat you. And so that is the main reason why we get all that information, so we can properly treat you and get you the best care possible. Because at the end of the day, your care is the most important thing to us here, and so that is why we pride ourselves on getting the outcomes. And so if we don't get all that information, one of two things could happen. Either you're not going to get the results that you desire, and also a catastrophic event could occur in rare occasions. And so a lot of these conditions, are asymptomatic. You look at cancers, and like I said previously, the small fractures and even the aneurysms, they're incidental findings. And so when we have x-rays and we see that, we always refer you out to get you the care that you need. And so just always remember that. Why the next time you think, why do I have to fill out this paperwork? Well, it's because of that fact. And so you should want a provider and physician to not just come in and talk to you, but be very thorough and do a proper examination. And so that's one thing you can always expect from us here, is that we're very thorough. We have over 9 providers here, and so we always work as a team to get you the best care possible and get you out if we can't help you. So I hope this was very informative to you, and once again, please come in and grab one of these handouts. If you have any questions, always feel free to ask. We're here to help. Have a great day.